Hi, my name is Kelly Ashton. I had my stem cells just not quite 6 weeks ago. And what prompted me to do that is I've had bilateral or both knee osteoarthritis that I have been suffering with for probably close to 10 years. Additionally, I had a fall about 4 years ago, and both my sacroiliac joints were displaced. I didn't actually have a fracture, but those joints were shifted, and it was very painful. And I've been struggling with that pain for the last 4 years because those joints will move back and forth and in and out of alignment, and it gets really uncomfortable. So with my knees, which I've just been having increasing pain, I just sort of assumed and really planned on, although it wasn't a very fun plan to think about, that I would be eventually having both knee replacements done. And that wasn't a very inviting thought, even though I was having a lot of pain, and I thought, well, that would probably be an intervention that would keep the pain away. But it wasn't something that I wanted to rush into. I just had my 60th birthday, and so it was something that I didn't want to do too soon, knowing that joint replacements eventually wear out, and I'm planning to live a good long life, and so it wasn't something that I wanted to do twice for sure. And when I heard about the stem cell therapy that was available, it's something I've been aware of for the last several years, and really felt the more that I've heard about it, though I didn't do a lot of research over the last several years, really felt that it was a very promising therapy. I am a retired nurse, so I'm not unfamiliar with a lot of the protocols and the therapies that are done for people with various illnesses and that type of thing, but I had done a little reading about stem cell therapy and just what a promising therapy it is for so many different things, and I found that so exciting. I just felt like this was such a possibility of a way to do something really positive for myself, something that was going to be, had the potential of being tremendously beneficial, and would keep me from having to have joint replacement down the line, which I found probably the most exciting part of all. And so I decided that day, after talking with my husband, that we would go ahead with the stem cell therapy for myself. It's not an inexpensive therapy, and it was a little daunting at first to think about that until I recognized how much it would cost me in terms of time and rehabilitation, as well as out-of-pocket costs to have joint replacement surgery. And I just recognized that this was an investment in me and in my future. I've been active all my life. I have 3 grandchildren that I love to run around and play with, and my limitations physically have really prevented me from enjoying that time to its utmost, and I really want to be able to have that and to enjoy a healthy, active life for several decades to come. So we decided to go ahead, and I came in and had my vitamin injections and my IV boosts, and then had my stem cell injections. And I had both knees injected, and I had the area around both of my sacroiliac joints injected. And like I said, I'm about 6 weeks out, not quite 6 weeks, and I've already noticed really impressive improvements. My knee pain is significantly less. My knee stability has improved, but probably for me the most noticeable change thus far have been with my sacroiliac joint. So this is a therapy that I'm really excited about, and I can hardly wait to see how much more improvement I'm going to have over the course of the next several months. But it's just so exciting to me that this therapy is available, and all of the potential improvements for people's lives that can happen with doing this really supportive therapy that doesn't require people to go into surgery or to have those kinds of experiences, but just so many positive potential outcomes can happen with this therapy. And I'm just so excited, not only for myself, but really for everybody that goes down this path.